There is an ailment which prevents mothers from seeing great moments in their children's lives, their graduations, weddings, great promotion at work, and seeing their grandchildren. Every mother's dream. This disease is cervical cancer. Cervical cancer is 100% preventable when detected early. If allowed to progress to the stage of full-blown cancer, it becomes very expensive to cure and highly devastating in presentations. Worldwide, one woman is killed every 2 minutes by the viral disease. World Health Organization says 630 million people are currently infected by the virus which causes cervical cancer. It is the human papillomavirus HPV which destroys tissues around the cervix, commonly referred to as the neck of the womb. Women are expected to take interest in knowing their status from the age of 18, but more especially from the age of 25. In Nigeria, 1 woman dies every hour of cervical cancer, and every year, a total of 8,000 women in the country die of this sexually transmitted ailment. Despite this reality, only 1% of the women population in Nigeria understand what cervical cancer is and how to ensure its prevention. A step into the streets to find out what Nigerian women know about the disease reveals the reality of this statistical data.
Have you ever heard about cervical cancer? No. Do you know you have to do a test? No. Do you think it's important that you should do it? To me, I don't feel that it's necessary.
And if you're still a doubting Thomas, you may need to hear from the popular Lagos hairstylist Bobby Eke of Bobby's Signature, who lost his mother at a very tender age to cervical cancer.
Happened when I was quite young. Yeah, my mom had cancer, cervical cancer. She gave up the ghost February 1980. She never even enjoyed any fruit. She died at 39.
Mrs. Rosanna Ene, a middle-aged mother of 6, is living with the disease. She did not know what it was at the pre-cancer stage, but now that she knows, cervical cancer is already taking its toll on her health, emotion, and finance.
Symptoms started 1990 December. After my normal menstrual period, then at interval, I start having some drops which continue for about 5 months, and it has a break. I did not count it to be anything. I did not even know it was a symptom. Then it's only this year that I have to go and remember those days that those things were symptoms.
For her daughter Ijoma, it's been highly challenging and traumatic taking care of her mother in the absence of their father.
It's not something I wish my enemy.
To see that women are made aware and prepared to stay safe from this highly dangerous, slow-killing disease, steps are being taken by the National Cervical Cancer Prevention Program to help women detect this curable cancer early. The organization says the first major and wisest step for every woman to take is to ensure she is screened. Findings reveal women's reluctance to go for screening is responsible for the high incidence of the cancer. To curb the spread of this disease, coordinators of the National Cervical Cancer Prevention Program, NCCPP, have been sensitizing religious bodies, the media, and civil society on the importance of early screening.
Unfortunately, the figures we have from hospital records is that it affects 10,000 women every year in Nigeria, out of whom 8,000 die, which translates to 1 woman every hour. And we know that if a woman screens only 2 times in her lifetime, her risk comes down by over 70%.
And on the 18th of October 2009, following the approval of Nigeria's drug regulatory body NAFDAC, Gardasil, a vaccine for the prevention of cervical cancer, was presented to the Nigerian public for the very first time by the Minister for Information and Communication, Professor Dora Akunyele, at a public enlightenment forum organized by the National Cervical Cancer Prevention Program, NCCPP.
Yes, it is good news that we have a drug right now that can prevent cervical cancer. I want us to remember that it's also very, very important that we get screened. And I believe that charitable organizations will come up to help NCCPP by donating some money so that they can buy this vaccine.
Gardasil is going to give Nigerian women protection against cancer of the cervix, cancer of the vagina, cancer of the vulva. It will also give the Nigerian man protection against cancer of the penis and cancer of the scrotum. It will give all Nigerians protection against cancer of the anus, cancer of the mouth and the pharynx, and other cancers that are related to HPV. It will also protect the unborn child who is at risk of having recurrent respiratory papillomatosis if they have an infected mother.
Backing up its campaign for cervical cancer prevention with action, the NCCPP has been tirelessly screening women. They spoke of their experience.
I was very afraid, but it didn't take time at all. It didn't even last up to how many minutes and I'm done.
I will still go and advise my colleagues at work to go for it too, because I see that it's very good. It's better to avoid it now.
Doctors say screening for cervical cancer is better done when a woman is not menstruating. If there is an existing vaginal discharge, she should first see a doctor for proper treatment before cervical cancer screening. To ensure the protection of the lives of the nation's women, the National Cervical Cancer Prevention Program is calling for the support of the government, corporate and religious bodies, as well as kind-hearted individuals. Take a step today to save lives.